Hi, I'm Farrah Stevens. I'm the PR and Communications Manager at the Animal Health Trust, and I've been working here for 5 years. The Animal Health Trust is the veterinary charity that is fighting disease and injury in animals. That's in the UK and across the world. And we do this through three main ways. There's our clinical services. We have a small animal and an equine hospital who are treating patients that are referred to us from first opinion vets. So if you take your dog to your vet and it has a complex condition, for example cancer, it may well be referred to our clinicians here who can use their specialist skills and the expert equipment that we have to help your animal get better. Alongside that, we have research going on in our laboratories. Our scientists and our vets work very closely together, trying to come up with new diagnostic tests, new treatments, new vaccines, ways that we can fight the diseases and injuries that are commonly affecting our pets. We're mainly focused on horses, dogs and cats, and we're looking into all sorts of illnesses and injuries that affect those, from inherited disorders. So there's a lot of work that goes on in the Kennel Club Genetics Centre working on inherited disease such as eye conditions, neurological conditions, things like epilepsy, things like bloat, and our scientists work with the dog world community so that they can collect the samples that they need in order to create DNA tests that breeders can use to breed healthy puppies. In addition to that side of the genetics work we're doing, we've also been working to create online breeding tools. There's a system called Mate Select, which breeders can use to manage genetic diversity within their specific breeds. So those are some of the key things that we're doing for the dog world. Alongside that, we do look at infectious disease, and that's potentially more in the sort of the equine population. But recently, in the canine population, we have been looking at things like seasonal canine illness, which is a seasonal illness that has been affecting dogs over the last few years, particularly dogs that are walked in woodlands and become quite severely ill shortly afterwards. So we've had an ongoing investigation at 5 study sites around the UK to try and pinpoint what may be causing that. And so that's an ongoing thing. That's another one of our studies that has been funded by the Kennel Club also. Then the third thing that we do, that we exist to do as an organisation, is education. So within our small animal clinic, within the equine hospital, within the research laboratories, you will find students, people training, furthering their skills, their expertise by learning from the experts that we have here. It's not only the training that we do here for the staff of the Animal Health Trust, we also spread the knowledge, the learnings that we find from all the patients that we treat, from the research that we're doing in the laboratories out into the wider veterinary profession, meaning that horses, dogs and cats all across the UK and, as I said, across the world do benefit from the work that we're doing here. Within the Small Animal Centre, we have a number of admitting disciplines that animals might be referred to us for help with. These are cancer, eye problems, neurological problems such as animals that might be suffering with epilepsy or stroke, dermatology. We see quite a lot of itchy dogs in our clinics. And alongside that, we have support disciplines such as our nursing and anaesthesia teams, but also our hydrotherapy team, who have a water treadmill and a hydrotherapy pool. Now they'll be helping patients, potentially neurological patients who may have come in for spinal surgery, to get back on their feet, but also animals that have complaints such as arthritis that just need less impact exercise, because time in the hydrotherapy pool is valuable for animals that need exercise that doesn't put so much pressure on their joints. We also do BAER hearing testing here. Dogs with a predominantly white coat are prone to deafness, so we have a facility where breeders and owners are able to bring puppies or older dogs whose hearing may be suffering to us for testing. It's a very, very simple procedure where tiny little acupuncture needles are placed just beneath the lower level of the skin, and this means we can monitor their brainstem responses. Usually in the puppies we do it when they've just had a full feed or they've just woken up and they have no idea what's going on, and it's useful to know whether these puppies can hear properly, and it's obviously useful for the breeders to know so that they don't repeat matings, because deafness is a genetic condition and can be passed down from parents to puppies. So as the Animal Health Trust is a completely independent charity and we receive no government funding, that means we're able to set our own objectives of the illnesses and the diseases that we want to investigate. And we do this very much through working with breeders, those people in the know of what illnesses and diseases are actually affecting dogs. So, for example, a breed club may approach one of our scientists and say, we're seeing more and more cases of a certain illness, and then we can work with that breed club and often with the Kennel Club to get out to wider breeder communities to try and gather samples from a number of dogs. We get DNA from simple cheek swabs. These are all submitted to us. Our research team are able to extract what they need from that, and they try to pinpoint a mutation that may be causing the illness, the disease that we're seeing in the animals. So we've done this for a number of tests that have now been made available that breeders can purchase to make sure that they test their animals to see whether they are carrying the mutation for the certain genetic disease, and then they can make educated breeding strategies to ensure that they don't pass that genetic mutation into puppies. Dogs will be identified as either clear of a mutation, a carrier of a mutation, or affected by a mutation. And often it's the preconception that people will not breed from anything that is a carrier. This actually reduces the gene pool and can lead to further problems. So we always encourage breeders to breed from dogs that are clear and a carrier, because you need 2 copies of the mutation to pass it down to the puppies. So breeding a carrier dog with a clear dog will not pass that mutation on, but keeps the gene pool more diverse. So the Animal Health Trust was established in the 1940s. It was established by a vet called Dr. Reg Waldridge, who felt that advances in veterinary medicine were dropping behind those of human medicine. So he wanted to bring advancements for animals up to those of humans, and it's been in existence since then. It costs in the region of £13 million to run the Animal Health Trust each year. As an independent charity, we don't receive any government funding, so we are reliant on the people who benefit from the work that we're doing to help fund us.